At the start of the second half of the 20th century, the primary therapeutic treatment for pulp infection was tooth extraction, followed by appropriate prosthodontic rehabilitation. Root canals were unreliable and uncommon. In the 1950 Dental Columbian Yearbook, Professor Carl Oman wrote, "The aim of the dentist who is truly conscientious is to save each tooth in health throughout life. Frequently, through accident or delayed care, the pulp is involved and endodontia must be resorted to. The loss of even a single tooth is a major catastrophe." That 1950 yearbook's dedication to the recently departed faculty member Dr. Moses Diamond said that Dr. Diamond was one of the true pioneers in modern dentistry, respected by his colleagues, revered by his students. Joseph M. Leavitt and Irving J. Naidorf graduated in 1940 and 1941 respectively from what was then called Columbia School of Dental and Oral Surgery, and they became good friends. Leavitt was one of Diamond's devoted students. During World War II, when Captain Leavitt served as a dental surgeon in the Pacific, he lost touch with his mentor, and both thought the other had died. After a happy reunion, Diamond invited Leavitt to join his prestigious practice and persuaded him to join the 14-person faculty in the Division of Operative Dentistry.
The faculty from the 40s, because they had very good practices, were able to bring in other part-time people. You can't educate the next generation with people that don't have experience in private practice.
At Columbia, Leavitt gave an impassioned introductory lecture to the senior class of 1953. Unfortunately, the treatment and procedure taught in this course, endodontia, is one which, if you don't learn and accumulate experience in it right here and now before you graduate, you may very well be afraid to attempt it in private practice, and you will probably have the same experience that I had. It began to dawn on me that I was guilty of moral malpractice, for I had been extracting teeth which could and should have been saved.
Endodontics became a specialty. Joe Leavitt and Irving Naidorf had a lot to do with that nationally and at Columbia.
Right after I got out of the Army in 1969, I started to apply to postgraduate endo programs. Met Dr. Leavitt, who interviewed me, and he invited me to come and visit his office the next day. So I, of course, was absolutely elated, and from then on I came every day.
We had a lot of lectures that were coordinated with the medical school. We had a lot of basic sciences. We had a lot of time to do more clinical work. And we also had a unique program that was set up by Dr. Leavitt, in which we were able to go out of our class and work in other endodontic offices to gain more hands-on experience in a private practice.
Doctors Leavitt and Naidorf were very big mentors of mine. They were good-natured and they set an example of a very high standard in the field. I only knew years later how much of a big impact they had made in dentistry and in endodontics.
Joe set up such a dynamic department with his faculty, and there was a great deal of friendship there. We used to meet in each other's homes. I remember going to Abel's home and Ma Ferdman's home and Dr. Rothenberg, Joe's home, where Harriet knew everybody's kids, their names, their ages. They became family to me. They really were. I think next to my father, I think Joe and Irv were my parents.
Columbia University was looking for an oral histologist, which is my area of expertise. And I was asked by the then rising dean, Dr. Moss, whether I would be willing to take on the job. Joe and Irving felt that I gave substantial background to what they were doing. They also were, of course, the people that took out the very tissues that I was teaching about.
I came to Columbia in 1972 as a freshman of a dental student. I was interested in pulp biology research and working in the physiology department medical school. Dr. Leavitt and Dr. Naidorf approached me to a concentration in endodontic for senior year. And I said, sure.
One of my teachers was Irving Naidorf, who was an absolute giant in our field. He was a microbiologist, an immunologist, and a real first-class scholar and teacher. He was a genuine Renaissance man. He was a pilot, he knew literature, he was just a wonderful guy, very, very down to earth. I think everybody loved him.
We had a tremendous number of faculty, from Drs. Marvin Ferdman, Murray Cantor, Abel Moranis. These were great mentors, but on top of that, they were wonderful human beings, and many of them allowed us to see very personal sides and know a lot about their backgrounds, such as Dr. Ferdman was a very accomplished cellist. Irving Naidorf was a clarinetist.
I guess I knew Joe Leavitt when I was an undergraduate, and he would give lectures. And my impressions of Joe always were a very classy, urbane, sophisticated kind of gentleman, witty and really presented very well. You got the impression as an undergraduate that if you wanted to do something special in dentistry, endodontics was like the pinnacle to reach for.
The beauty of the Columbia program was just in the attitude of the faculty to the students. And we treated them as doctors and not as kids.
When I was a new faculty member, Joe Leavitt came in to lecture. He had a very special style of doing it. He started with "seat the patient." And that was, to me, a very nice way of saying this is clinical business. We are going to talk about practical things.
So first presentation I remember in Hollywood, Florida, that it was a very small organization. It fit in one room, about 200 people. Now it's 5,000. Dr. Leavitt was instrumental in providing a fund for me to go to first my endodontic meeting, and that's where my endodontic career took off. My research subject matter was so interesting, so there's a lot of people talking about it afterward.
When I was interested in engaging in some research work, I made an appointment to speak with Dr. Leavitt and present to him some of my ideas of what we were going to do. Dr. Joseph Leavitt really was the backer of this. We presented the research with beautiful slide presentation photographs at the AAE, and we were commended by many of the people who came around who were from other schools as to the work that was done.
Dr. Leavitt was able to get $30,000 Lou B. Mayer Foundation grant. The $30,000, no strings attached, no overhead, is a huge grant. Because of that, I was able to establish a laboratory.
Joe Leavitt was an exceptional person at fundraising. I really wanted to find out what was his trick. And I said, I don't feel very comfortable asking people for money. And he looked at me and he said, don't think about it that way. You're not asking for yourself, you're asking for the institution. It was probably the best piece of advice I ever got.
At the time, I think there were only, maybe 8 or 9 other endodontists in Manhattan. Patients were, to say interesting would be an understatement. Actors, musicians, people from the arts, politicians.
In 1953, that was a Dean's Day panel discussion, and I am going to cite some of the comments that Joe Leavitt made at that time. And he says, Dr. Hickey, I'm glad you used the term pulpless tooth instead of the misnomer dead tooth. It is not dead, but it's really a tooth from which the pulp has been removed, and it is very much alive by virtue of the integral attachment it has to the body through the periodontium.
Sometimes I think that endodontics has always had a siege mentality where dentistry may have thought it was easier to do something else. Today, of course, there's the pressure for implants instead of saving the natural tooth.
Truthfully, who wouldn't want their own natural tooth for as much of their life as possible? And yet we're fighting against the tide of people wanting to remove pretty decent teeth in order to place implants.
There are a lot of attempts and research is going on all over, and particularly at Columbia, in regenerating the natural tissue to come back into the pulp. I'm sure both Irving Naidorf and Joe Leavitt today would be amazed and excited by the new equipment and the new procedures that we do.
There is a theme in the Naidorf lectures, and that is that they are biologically oriented. We want them to know that first and foremost there is a patient attached to the tooth and the root canals, not just a technical problem. Our subject, of course, is endodontics as an adjunct to full mouth rehabilitation. And in reviewing some of my previous lectures dating back to 1951, the term endodontics was not yet in use. At least 2/3 was attempts to convince the audience that root canal therapy was demonstrably successful and dependable. But endodontics has made such a remarkable progress since then that today's modern dentist is fully aware that endodontics works, and he uses it more and more widely in his practice. I think, this shows that Joe Leavitt was ahead of his time.
My friend Carol Mann and I were the first 2 women to complete the endodontic program here. It was an honor to be asked in the first place to join Dr. Naidorf's practice and then to join the faculty.
Had I not have Joe Leavitt or Irving Naidorf as my mentor and supporter, I will not accomplish as much as what I've done.
It all started with Dr. Leavitt. I'm glad that I've been able to do my part in paying back for the opportunity that was given to me.
In 1980, Leavitt stepped down as chair of the Division of Endodontics at a gala testimonial event with lots of speeches. As his son, I sang a parody, "Your pain is gonna clear up, we'll do a root canal," and it went on from there. In 1985, Leavitt wrote a eulogy for his good friend Irving Naidorf. In 1952, when Irv joined me to help teach endodontics at Columbia, within a week or two, the magnitude of his intellect and knowledge appeared. For 30 years, we shared a box at the opera. Remembering Irv is a true pleasure of infinitely rewarding comradeship. Leavitt passed away in 1999.
Joe was bigger than life. You knew that he loved his practice and he loved Columbia.
Endodontics, to me, is a field that just is trying to preserve our natural dentition for as long as possible. And now these days, with the advent of the operating microscope, cone beam technology, we're able to do the finest job that is imaginable with such accuracy that if we go back to the days of Dr. Leavitt and Dr. Naidorf, they would be thrilled and very impressed to see where this specialty has gone.